Hi, this is Dr. David Zahaluk from Main Street Medical Care, and I'm talking to you today about weight loss. And I'm going to try and make it a little bit different than what you might usually hear. This is not what to eat, this is more how to eat. And so there is a limitation in terms of what a doctor can do to help you with weight loss. The medical model will just go so far. It's useful to rule out a medical condition such as thyroid disease, insulin resistance, sleep apnea, medications that are causing weight gain. There's a variety of things there. Um, Doctors can prescribe appetite suppressants. The problem with that, quite frankly, is that there's no long-term studies that document the success of appetite suppressants. I think they're useful to give people a head start, but there's known cardiovascular problems with their use, especially prolonged use. And the big problem is if you have a low metabolism, and a lot of people who struggle with weight have low metabolism, it's not going to help. In fact, it'll probably make things worse. Then you've got the surgical options. And that's very appropriate if you've got a medical condition that's worsened by your weight condition, especially if you have heart failure that's out of control, diabetes. That can be a very useful intervention. But that excludes a large majority of people who have weight problems. So the medical model is helpful, seeing a doctor is helpful, but it can only take you so far. And so the question that's raised by that is, what can you do that will help you be successful? If you review the literature, you'll find that there's 5 factors in general that predict success long and short term with weight loss. And they include, number 1, the duration of your attempt. So if you try for 2 weeks and get frustrated and give up, guess what? You're not going to lose any weight. If you can make a lifelong change, even if it's a small change, it'll have a profound and very positive effect on your weight loss. And also, it's kind of obvious, but your initial weight loss and the attempt is going to be very important. So if you lose 5 pounds in the first 2 weeks, you might be energized, motivated, say, I want to do this more. And again, if you don't, usually you're not going to be with it as long. So that's a key factor. Accountability is big, and there's a variety of ways to get accountability. You can keep your own journal, either on paper or electronically. You can have an accountability partner, make a bet with someone, make a promise to someone. You can use a variety of clinical approaches, including Weight Watchers, Jenny Craig. They're founded on accountability. You can even see a doctor and weigh in with them at intervals, or measure your waist at intervals to track your success. But accountability leads to results. If you're accountable to someone beyond yourself, you will do better. Support is another key thing. Is who do you talk to when you're having a bad day, when you don't feel like continuing? The presence of a supportive person can really, really help your success. And I would really encourage you to find some source of support to help you, because not every day is going to be easy on this path. It's worthwhile, but not necessarily easy. Exercise is really necessary to maintain a weight loss. Interestingly, it's not as successful with the initial weight loss, although it helps, but maintenance of weight loss is all about doing exercise. So you need a regular exercise program. By the way, exercise helps you to change the way that you feel about yourself and your self-image, because people who exercise see themselves as stronger, more capable, more endurance. And then the last thing is the effective use of a cheat meal. And specifically by that I mean your ability to get back on track. Everybody who's been on a diet has cheated, and always will. So to think that you're going to do perfectly with a diet is just set yourself up for failure and impede your success. Better to have a way where you can practice getting back on track, where you forgive yourself, start fresh, and say, here's what we're going to do now. I'm going to get back on track. So those 5 factors really determine who's going to be successful and who's going to have a problem.